So what you need to do, right, is go through the paper as quickly as possible, because if you second guess it, you are less likely to get the right answer, because basically these are questions where you know the right answer, because it's all ethics and being a nice person, but there's a few rules that we'll go through, okay? So this is what they say, okay, that they need, assuming that you know this stuff, and they're going to check because they believe that if you've been on the wards that you're better at professionalism, clinical pressure, and all this stuff, but that's not true. Basically, if you do enough of the questions, you'll see how they work. The other problem is that the mark scheme is such that everyone gets a really, really high mark, okay? They say they won't give any specific feedback because it's not meaningful. They're right there, okay? It just depends on how you do on each question. But I'll just show you a few examples and then you'll understand what I mean. So we're going to go through the format of the exam, how to approach the exam, the fact you have some really basic knowledge, which you definitely have, okay? And then the real thing is to avoid some pitfalls, okay? And that's what catches people out. And then we've got some trial questions on these different topics: consent, confidentiality, professionalism, and patient safety, okay? Okay, now someone else, Asmita says she can't see my slides, okay? So I don't know why that is, but I'm gonna keep going. Because you all can, I hope, right?
Yes,
okay.
we can.
Good, okay. So it used to be a paper-based assessment, okay? But now there's these new rating questions, and of course it's all on Pearson VUE. There is a mock exam on Pearson VUE that you must all do, okay? You must have a go at it. There's a video to watch, which is no different to any other question. But the real reason to do the mock exam on the Pearson VUE site is that it's a bit of a surprise in that you can go through the paper and you can mark the ones that you're not sure about, but you can't choose the questions until you've gone to the very end. And that means you have to do them in the order they're presented. You can't do it in any order you like, okay? So you definitely need to practice this. Important things are there's no negative marking, so you need to give yourself as much time as possible, going as fast as possible, because you need to put something down for every single question, okay? A blank gives you a 0 for sure, okay? And I'll show you why you must at least guess. You mustn't leave any blank. And now, of course, this year it's not paper-based. Okay, so you've seen these questions where you rank 5 things in the appropriate order, and I'll take some feedback. And basically, there are 2 important points. One is if the answers are D, C, E, A, B, and you put that, you'll get 20 out of 20. If you are a terrible person and you invert them, so in other words, the best answer is D, you put it worst, and the worst is B, and you put it best, okay? And you completely invert the order, you will still get 8. And that's because the middle one is in the right place, okay? And then these 2, A and C, will get you 2 each. So you will get 4 plus 2 plus 2. It is the minimum possible mark, okay? If you are completely evil, you'll get 8 out of 20, which is 40%, okay? So that means you must not leave any blank. And the focus to get a high mark is to get numbers 1 and 5 correct. And they're easy because number 1 is save the patient. Number 5 is steal his wallet, okay? The middle 3, we can't agree on. Doesn't matter, because if you get 1 and 5 in the right place and you get 2 4s, that one and that one, then of course the middle 3, you'll either get 4 or 3. So that's how you get a high mark in this thing. You do 1 and 5, get them the right way around, okay? Now for most questions, they're standalone. You're not ranking what you do first and then second and third. You're ranking the action you'll do immediately in isolation would be the best, and what's the second best, and what's the third best. Now they tried to change it for a couple of years. Didn't work, okay? The other thing is that supposing you don't read the question and you just put down A, B, C, D, E, on average, you'll get 12 out of 20, okay? That's what will happen, because you'll get some in the right place, some in the wrong place. But basically, if you are evil, you get 8. If you don't read the question, you get 12. So an educated guess will get you 14 or 16, okay? Or 18, or even 20. So obviously you want to read the question quickly, put down 1 and 5, and guess the middle three if you haven't got time. You have got time, so I'm not saying guess randomly, but if there's any doubt, don't think too hard whether 3 and 4 should be 4 and 3. Because if you waste another minute rereading the middle options, you might go from 18 to 20, but you'll lose 2 minutes and then won't finish. And if you don't finish, you get 0 for the last question. Okay, so do not do that. Move as quickly as possible through the paper. Okay, then there's the other format where you choose 3 of 8. Now these are only worth 12 marks, but they're worth more because as a proportion, you can't guess these quite so easily. So as I said, right, let's come back to these. These ones, if you guess, you get 12 out of 20, 60%, right? If you guess the 3 of 8, you might get 1 right, which means you'll get 4 out of 12, which is only 33%. So guessing these is a bad idea. So what that means is, if you're going to spend more time on a question and guess some, you're going to spend time on these, okay, and guess the ranking questions because you'll get a good mark whatever. I'm not saying guess if you have got the time. Try not to guess anything, but these questions are more discriminatory because there's a different, you can get a lower mark basically, okay? If you've got any questions, you can put in the chat. Okay, and then the other thing is these 3, I'll show you some examples, work as a package, 3 of 8 things. And so which 3 things work together, okay? The most important thing is whatever comes into your head first, put it down because it's going to be right. As you know, there's a very, very skewed spread. So everyone gets a really high mark. And the problem is this spread is worse than the spread you'd think because basically, they calculate your score out of 50 by spreading you all out and looking at the bottom and the top scorer. So this is the time when one person who gets the bottom score has an influence on everybody. And this clearly says it, right? So the top score, let's say you can get 1,040 points, okay? Let's say the top scorer on your setting is 984 and the bottom scorer in your setting is 280. If you get 900, that's how they calculate your score. It's 900 minus the bottom score divided by the difference between the top and the bottom, okay? Yeah, you can have the slides. They're actually already on the internet. I'll show you where it is in a minute. Okay, 900 minus 280 divided by 980. So what that means is this score of 44, if the person who scores bottom is a different mark, everybody moves, okay, and quite badly. So here's the data. So there is the top and the bottom score in this column here, okay? And this is you. So if you get 900, you'll get 44 out of 50, right? If you get 984, get 50. If you get 890, so I'll put a range of scores here. Now, supposing the bottom score gets 350, so that's the lowest score. This is a formula I use, okay? 350. Then, of course, everyone goes down because the bottom score is not quite so bad. And so everyone gets a lower mark. So it's not worth trying to work out what your actual mark is going to be and whether your mark this time is a good one or not, because the bottom scorer has a huge impact on everybody. Okay, so this is here, the bottom score is 450, which is a pretty low score, can I say, right? Because you guess you get 40%. So, so that's the problem, okay? So don't try and think about the actual mark. Just zoom through it as fast as you can, and that will give you your best outcome. Now, how to get lots of marks is know a few things. So for example, the medical hierarchy, who to ask. You start with a colleague, another F1, okay? So you're in this situation, an F1, and if you need help, you work up the hierarchy depending on what the problem is. Don't forget, it's really important to know what OTs and physiotherapists do and when they're important. And if you practice some of those questions, you'll see them. But if you've never heard of what that is, that's not good. But you start with the F1, you work up, okay? There's the F1 and F2 who are foundation. They are so-called pluripotent. They haven't specialized. They're a bit like medical students because they haven't decided what they want to do. And therefore they're training in anything. There might be a bit of psychiatry, a bit of medicine, a bit of surgery, and so on. But then the next step is they become a bit more senior. Now they're called IMTs, used to be called SHOs. And those individuals have chosen a college, okay? At that point, you decide, do I want to do medicine, College of Physicians, surgery, College of Surgeons, obstetrics, and so on. Okay, and then you're a bit more specialist, and so you ask about that disease. You need to know a bit about the GMC principles, role of a junior doctor, and they're answered as if you are an FY1 and you know what FY1s do, which you do. Okay, so who do you turn for support? Here's the hierarchy going upwards. So start with the F1, they don't know. So then you ask the core medical trainees, or they're now called IMTs. They used to be called SHOs, right? And they're above you in the hierarchy. The thing about these people is they have chosen one of the main specialties, so medicine or primary care. So if you're a core trainee in medicine, then they will be able to give you some advice on something medical. Or if they're core trained in surgery, they can give you surgical advice. The next step up is a registrar, and they are people who've chosen a subspecialty within their core subject. So if their core subject is medicine, the subspecialty might be gastroenterology or endocrinology. So the registrar will know a bit more about the specialty on the ward you're working on. Then there's the consultant, who's the head of the team, and don't feel afraid to go up to that person and ask for help. And the most important thing is, if you're out of your depth, ask for help. And in real life too, right, if the junior doctor isn't sure what to do, I don't want them to guess if they're under my care, because if they get it wrong, it's my fault, okay? Because the consultant is responsible for all of these trainees. If something goes wrong, the registrar or the SHO or you make a mistake and something bad really happens, they should have asked me, and I'm responsible. So do ask the consultant. Who else is around? There's the charge nurse or sister or matron. That's for ward matters and care of the patients. And then remember the OTs, physios, and pharmacists who are really important in this exam for you to know what they do. Okay, and then within medicine, there are two other groups of supervisors that you will have next year. You'll have a clinical supervisor. That is the consultant looking after the patients that you look after. Okay, so when you go on a ward round, there'll be a consultant who's looking after the patients, and you'll be the F1. Let's say you start off with 4 months of urology, and then 4 months of endocrinology, and then 4 months of acute medicine. So urology is a surgical subject, so you'll work with a consultant urologist. One of them, let's say there's 5 urologists in that hospital, one of them will be your clinical supervisor and will be mostly on the ward when you're on the ward, okay? Then you move on to endocrinology, and you'll get a new endocrinologist who is your clinical supervisor on a different ward. And you might move on to acute medicine. So your clinical supervisor changes so that the clinical supervisor knows the patients that you do, okay? Then there's the educational supervisor. So that is someone who you keep for the whole year, okay? It might be the same person, it probably will. So quite often, when you first arrive on the first week of August in your new role as a urology F1, you'll have a clinical supervisor who might say, and I'm going to be your ES, your education supervisor as well for the first year. So that's fine. So the first 4 months, you have the same person as your clinical and educational supervisor. And then when you move to endocrinology, you get a new endocrinologist who's your clinical supervisor, but you keep the urologist as your educational supervisor. So they get to know you. And at the end of your year, they review your portfolio for the 3 jobs you've done and decide whether or not you can be registered with the GMC. And they write that little thing on your portfolio saying yes, and that's really key, okay? So you need 3 good reports from 3 different clinical supervisors, and then your ES authorizes it. So when you are in training, of course, and things go wrong, the first person you ask is the consultant on the ward, the clinical supervisor. And if something's going wrong, then you tell them. And if the clinical supervisor can't help you, then you go up a step to the educational supervisor, okay? And I know quite often they're the same person, but that's the order of how you're meant to go up the ladder, as it were, okay? And rarely, if the educational supervisor can't help you, then there's the postgraduate dean who supervises the whole region, and then you can ask the GMC for impartial advice. That's the thing. There's a comment here. It's a long story here from someone. Okay. Okay. All right. Well, I'll answer that question about when things go wrong with prescriptions and things like that. I'll just tell you one thing, right? And that is that that you need to just move through the question. So that question you put down will have 5 options. And so you're ranking things. So it's a much more gray than a black and white. This is what you do in this exam. But I'll read the question properly in a minute, okay? And then there's obviously, if there's a patient who is posing a danger to staff or other patients, then you can involve security, although they can't do very much, except make sure that there's not people being murdered. And they call the police if someone breaks the law, but only if they break the law, okay? Okay, let's to the principle. So each question is a scenario in a clinical setting. The UKFPO say, yeah, I'll record it, okay? I'll record it. It'll be on YouTube probably, okay? So no clinical knowledge is required. Now, this exam is a bit weird, right? In that there are some things you should do, but it's just not practical. And so you would actually do something else. But in this exam, you need to pretend that we're in an ideal world and that you could all do what you should do, however impractical. It does say this in the rubric, okay? The right answer is what you should do, not what you would do. Okay, so we've talked about this already. So we're going to talk the commitment, coping with pressure, patient safety, being patient focused, and working as part of a team, okay? So here's my key thing, okay, which is answer every question. Don't second guess and think about it. Just write down what you think is the right answer and move on, because timekeeping means you won't have time and you must finish the paper. You don't need to color the circles in like we did in the old days in paper, but still it's slower than you think. So practice on the online version, okay? I was telling people to do the second part first, but unfortunately I now realize you can't do that because the order is forced, okay? What type of scenarios would not go to mid-hierarchy but go straight to the consultant? Okay, it just depends on who is available in the exam question. So they say your options are A, they won't go start the registrar. There'll be options like ask the registrar or give the patient a drug, or we'll show you an example, okay? So let's first of all start with consent as a good example, okay? So you are the FY on the chest ward and the patient become unwell. The registrar asks you an ABG, but the patient doesn't want it because it hurts. You have no reason to believe he has not got capacity, okay? So the patient has got capacity and says, I don't want that blood gas. This is real life, okay? What would you actually do? And your options are, okay, I won't pursue it. You don't want blood gas, that's absolutely fine. Write notes that he's refused. Insist that he has an ABG and proceed anyway. Ask for advice, the registrar, the option here. And then explain to the patient the need for situation. Obviously, that's the right answer, right? Because of the wording. So this is actually, this whole exam is a test of English. And you can see that E is a nice thing to do. Explain to the patient you need it, it's good for you. Your blood gas might show that you're very sick. It's really important. So E is definitely the best option, right? So that's number, see, as I said, do 1 and 5. If the best option is E, what's the worst option? So read the wording, okay? There are 2 things. Insisting is a bit mean, okay, and almost abuse. So maybe that's a really bad option. And also, though, it's not safe to say, okay, I won't bother the gas, because you've been told you need to do the gas because it's in the patient's best interest, okay? So this is what those of you who voted have put. So you can see all of you have said explain is the best answer. This is paper C, yeah? All of you have said, who've done it, have said that explaining is the best thing. Insisting, a horrible thing to do, forcing to have a blood gas, almost all of you put that, okay? Some of you have put, so this is so you know, so I told you how this works, right? So what you've done is you voted for certain options, and I've graphed it out so that green is the best option and blue is the worst option, right? 1 to 5, how they should be ranked. And you can see that everybody agrees that explaining to him nicely is the thing to do. And you all agree option 5 is insisting is a bad thing. And the middle 3, no one can agree. But actually, there's a bit of agreement here because basically ask for advice comes second, document and notes comes third, accepting doesn't want it is pretty bad because he might become hypoxic and not survive, okay? So we're pretty clear then that the best answer is E, the worst answer is C, and the middle 3 are pretty okay. And that is how to do all the questions, but the best and the first down. Paper C was emailed out, I think, to everybody, but if you haven't got it, it'll be online. I'll put it on the same space. I'll show you all that page in a minute. Okay, so the best answer is E, the worst answer is C, and the middle three, we all don't much agree. But if you get it in the same order as most of you, then you'll get 20 out of 20. If you get one in the wrong position, you'll get 18. You swap two over. Okay, I'll have a quick look at the chat and see where else. Oh, it's both. Okay, I've been through all of these. Okay, so I've been doing this course for about 15 years, and every year I get the same spread every time. It's very, very consistent, and I've also got some data. You will get yes, you will get individual feedback as well. Okay, so you'll see the questions again with the right answers. So it says he's got capacity, and that means he can refuse. If patients do not have capacity, you need to know how to decide if someone's got capacity. Here it is. If they can, 1, listen to you, 2, process the information and understand it, 4, retain, repeat to you back so that they understand, and then they can relay back what they want, then they have capacity. Okay. If the patient does not have capacity, who decides? You do. Okay, you decide. You are the doctor. The doctor has ultimate power in this whole thing. Okay, and that's really quite important. And that's important because you don't have any personal gain from anything that goes wrong or right. Okay, so the patients can't tell you what they want. You need to look at the patient and decide what's in the patient's best interests. You can ask the family, not what do they want, but ask the family, because you know your relative, what would he have wanted? Now, they have the problem with families is they have a conflict of interest, because if the person dies, they might inherit a large amount of money, and however unpleasant that is to talk about, it's a fact. And therefore, you need to be a little bit careful about asking family, especially if there's disagreement within the family. Okay. Some of the family members will say, I have a power of attorney, which may be that I signed a document saying I want my house to be sold, and I've given the power of attorney for the sale of the house to my son or daughter. They have a power of attorney. Okay. Now, the problem is that if I have a power of attorney, that's only for that thing, and I can't therefore make decisions on health with a power of attorney. However, there is a thing called a lasting power of attorney, which is a special change in the law about 10 years ago, which meant that if I really trust somebody and I say, look, I really worry that I might lose my marbles, I'm with it now, and I want you to have my lasting power of attorney if I ever lose capacity. I might do that if I have a diagnosis that suggests that I might become paralyzed in the future, like some horrible neurodegenerative condition. So I'm with it, alert, but I might become unable to tell you my decisions. In that situation, I will entrust somebody maybe with a lasting power of attorney. That's very powerful, because if I do sign an LPA, a lasting power of attorney, the person who is the recipient of it is able to be me when I can't talk. Okay, and that means that if they say turn off the ventilator, that's like me saying, I'm the patient, I'm on the intubator, and I want you to turn off my ventilator. So that's a really powerful position, the LPA, the lasting power of attorney. Okay, so yeah, that's about consent. Now, here is a similar question with 3 of 8. Okay, you're the FY1 working on a PEDS ward, and you're asked to see a 14-year-old who's got septic arthritis. Your consultant has asked you to prescribe empirical intravenous antibiotics. Okay, the parents say yes, but Billy, he's 14 years old, doesn't want a needle, doesn't want to stay in hospital, wants to go home. He's not happy. You need to choose 3 options. So what are your options? First of all, accept the parents' wishes and go ahead with treatment. Be sympathized with Billy and explain to him, it's always good, the benefits of treatment. So that sounds good. So B sounds like a good option. Now in this situation, you don't need to choose 1, you choose 3 of 8. Okay, so B wins, A is pretty good. Consultant may be able to help too. So D is not a good option, because if you accept that Billy does not want treatment and do not pursue the case further, I mean, I know they say you don't need any knowledge, but I can tell you, if you have septic arthritis and you don't give IV antibiotics, the patient's going to die, okay, eventually, because sepsis is life-threatening, especially if it's in a joint. So D is a bit dangerous, okay? That's and if they say you don't know it, the consultant says give it, so therefore it's what you have to do. Tell the Jones family they've come to a mutual agreement, so that's crazy. That's obviously nonsense. Assess his capacity to refuse the treatment. That's a tricky one. Discuss it with the charge nurse. Offer to give oral antibiotics. That sounds very tempting, right? But the knowledge part of you should say orals don't work with septic arthritis, okay? He can't go home. That's why we have IV antibiotics, because it saves lives. So H is terrible. G is not very helpful. F, away from the bottom here, assess his capacity. He has capacity, but he's 14, and therefore the parent saying he can have it is like him saying, I'm going to have the drugs. So that leaves probably the best three of A, B, and C, right? I think B is the top answer, followed by A, followed by C, because the consultant will have to come along and help drive the child to saying he's got to have it. That's not, let's see what you guys put. So this is upside down, by the way. So the bottom one is A, okay? And you can see that over 200 people, and this happens every time, have put A or B or C. One, I'm guessing, I don't know how many this is, a very small number has put don't pursue. That's not a good thing to do at all. Small numbers have put these other answers, okay? But yes, so A, B, and C win. Okay, so the capacity things become a bit more, we'll talk a bit more about capacity when it depends on the subject, right? Septic arthritis is pretty black and white. It's all about Gillick competence. We'll come back to that in a minute. I think it's on the next slide, okay? Oh yeah, I got this question, not from one of you, but from the previous year. Surely one should assess the young person's capacity to make a decision such as this before forcing the treatment appointment. This is an email I got from a student. I've checked the GMC guidance, and they clearly do not state that you should simply give the treatment unless you know they have capacity, which in our question, we don't. And then a screenshot of the GMC website, okay? Now, it's a bit tricky because there are differences between, it says, you can balance the harm. You haven't got time to do this balancing act, okay? You need to just go for the best possible answers, okay? And trying to assess whether he's got capacity is not going to help his survival. And so you just need to get on and say, look, this is not the right answer to move forward, because while you can start discussing ethics in this exam, there's no time to do it. So it's A, B, and C, which are definitely the best three options. And if you put assess his capacity, that sounds nice, but actually it's the wrong answer for the exam. Okay, I'm sorry about that. And then there's a little bit of a trick that they might put this in about Gillick competence. It hasn't ever come up in this exam, but it might do. And basically, if you're over 16, then you're an adult. If you're 16 or younger, then you might be able to consent without your parents, especially if we're talking about termination of pregnancy or something. You can't refuse treatment. And you don't have, if you don't have capacity, then you can ask the parents if it's in their best interests. And then you've seen the court cases involving children have turning off ventilators and things. You get the court involvement. And in fact, the court will come very quickly. So there are on-call lawyers for this kind of thing. If there's a serious problem, then you just call in the on-call lawyers who will get a court order. Lawyers cannot make a decision, but a judge can. So you need to get a judgment. Okay, and then there's also about disclosing information about people to others, and that you can think about. I wouldn't worry about English scoring. Just go for what you think is the best option, okay? Because no one can agree. Okay, that's the whole point of this exam. It gets more tricky, right? Here's another one. Best three. You've got a 10-year-old with fluctuating consciousness admitted following a road traffic accident, accompanied by her parents. The child needs an urgent blood transfusion. The parents are Jehovah's Witnesses and are refusing blood products. What do you do? So there's a really tricky ethical dilemma, okay? And that is, do you transfer them immediately? Do you overrule the parents and because the child's life is at risk? Do you discuss with the parents the importance of blood transfusion in order to save the child's life? That sounds like a good thing to do. Discuss, yeah? Continue with fluids, but do not transfuse any blood products. That's not unreasonable. It gives you a bit of time, although there will come a time when they need blood, but that can be after you've handed over to someone more senior. Obviously, ease is a bad idea. So leave the room and give blood. There is a liaison committee for Jehovah's Witnesses, but they're not going to help you in this situation. G, a consultant hematologist is useful only if you're talking about blood groups or they've got some funny antibody. It's not helpful in this situation. And then you can discuss with your consultant about a court order. So H sounds like what you're going to have to do, right? So H, yes to H. Discuss with the parent the importance of blood. C, that's also quite, so C and H look good. And then the third one, there's a number of different options. Let's see what you guys put. Go forward here. From the bottom, so A is not a good. So it looks like the most popular answer was C. Discuss with the parent the importance, yes. Give IV fluids, that's a good option because it gives you a bit of time for H to be enacted, which is get a court order through over all the parents, okay? And those are the best three. The other ones are less good. They're not completely wrong, but you need to choose the best 3 of 8. And that's good. There knew there'd be something in the chat from this because it always generates a lot of. Is there enough time to carry out option B? Option B, sorry, which is at the bottom here. Overall, the parent decision as a child's life is. Oh yeah, there is. There is enough time. So I'll tell you, I have. This is real. Okay, we have patients who are Jehovah's Witnesses who don't and bleed terribly, and you can keep people going on fluids alone without blood for quite a long time. You're gonna, yeah, sorry, option H, yes. There is enough time because you can get a court order really quickly if you call the on-call people. Your consultant needs to do this, but that's what you're going to need if you want to give blood. You cannot give blood without consent, and even if you do to save the patient's life, if they believe they're going to go to the hellfire forever, that is not good. Okay, that's forever, not just in this lifetime, and that's what they believe, and they're entitled to that belief. Okay. So the right 3 options here, someone's asked me the question again, are the most popular ones: C, D, and H. Okay, they're the best options. Okay, so then there's questions about if the child wants it and so on. So it's a bit tricky, right? There are 2 other caveats to this. One is if you believe that the patient is being coerced into refusing blood, if you believe that, you can give blood. You've got to do the right thing, okay? I have known patients who come in and there's other people outside, family members, religious people, and they're all standing around. He goes, yeah, I don't want any blood, I don't want any blood. And then they leave. He goes, hey, I want some blood. I don't want to die. I don't want to die. I don't believe this, okay? And so obviously you do that. You give the patient blood, okay? Why is D better than G? Now, hematology is for, do they get blood group B or blood group C or A, B or whatever? And if they've got funny, funny antibodies, that's when the hematologist can help you. They are experts in blood tissue typing and what transfusion to give in someone who's got funny antibodies. They're not ethicists, okay? You need an ethicist for this, not a hematologist. So the best options, I'll tell you again, because people keep putting in the chat, are C, discuss, was a good word. D, give some fluid to buy some time. And H, use that time to get a court order. They are the best options. Yeah, I'll give you a recording of it. What's the difference? It's never, no, there's no such thing as never, okay? So this is a problem. You are thinking like a scientist, okay? This is an ethics exam. There's no never. You have to read the word of the question. A small difference in the wording changes the right answer. It's not science, okay? It's not science. So don't try and work out the best answer, okay? Why is D better than B? Because the wording, let's have a look. Why is D better than B? Overall, the parents as the child's life is at risk. Well, you don't need to do that. It's not a terrible answer. You don't need to do that because you can buy time with fluids. Okay, I think the problem is that we teach you to be scientists all the way along, and you're trying to do that. And actually, this is an exam which is completely bizarre, and you have to get used to that and just go for what the best three are going to be. Okay. So here we go, C, D, and H. And I know there's lots of chat and anger, but that is tough, okay? Because that's how it happens. Chitra wants to know, why doesn't the hospital liaison committee deal with this? They can help, you can call them, okay? But they're not going to be much use in this short run. They are to try and mediate to help the patient come to terms with that kind of thing. It's just that it's not the best answer. Okay, let's move on to keeping confidence, okay? And when to break confidence. If it's dangerous to keep confidence, then you break confidence. So you're working in an AAU, which is the acute admissions unit, clerking in a patient with paranoid schizophrenia, and she says, I've got a gun, I'm going to kill my mother. You believe her intentions are, this is the key thing, okay? If you think that she's going to kill her mum, okay? What would you do? You've got to rank these 5 options, okay? So give some advice, that sounds okay. Disclose the information to the police only if the patient consents. So the problem is the patient might not consent and kill mum. Arrange for detention, that's not unreasonable. Discuss that directly with the police as a priority, and respect the patient's confidentiality. So that's a bit more tricky. It's easy, the worst option is E, isn't it? Because if you respect the patient's confidentiality, then you'll have a dead relative on your hands. So E becomes quite a bad option, okay? And then the patient's not going to consent, so B is also quite bad, okay? So what are the safe things to do? You can either get some advice, that sounds like a really good idea, or talk to the police. So I think, let's see what you guys have put. So we all agree the very worst thing to do is respect the patient's confidentiality, because that'll result in a death. Getting some advice seems to be what you all want to do. So yeah, that is the most popular answer. So let's go for that. That is the right answer in the list. Okay, and then the middle one no one can agree on. So the second one was arrange for the patient to be detained, followed by the third option, which is discuss with the police directly only if they consent. Okay, oh, no, discuss it directly, and then this is only if they consent. So this is all most in agreement, so that's all right. Yeah, these questions were written by the UKFPO when they opened the exam, and which is 10 years ago, and these are the answers. And as it happens, see, a majority of people, when given this, and if a large number, get the answers right as the majority, but there's always a bit of, you can see this variance here between the middle one. No one can get the middle ones really. Okay, so there's A, C, D, B, E. A is the best answer, E is the worst answer, and the middle 3 are C, D, and B. Okay. So here's some rules. The GMC says you can break confidence if the law says, in other words, the judge, not a police officer, not a lawyer, but a judge says you must break confidence. Okay. If the patient consents, there's no problem there. And if it's in the public interest, which is a bit grey, in other words, if there's an infectious disease that the patient has and they're spreading it around, then you can break confidence to let relatives know, for example, that the patient has got that condition. Okay, that really applies to sexual contacts of HIV, for example, or hepatitis B, where the patient threatens to have sex with lots of people. Okay. Yeah, okay, you can't do a patient as an FI1. That is true. You have to ask somebody else to. Okay, so the judge, how do you know if the judge wants to break it? So in other words, there's a case. Okay, so what happens is you go and ask whether you need to break confidence, and the law says you must, because this condition will spread around the entire community if we don't tell people that this person has it. Okay. If only you get the police involved if there's a crime, okay, like as it says there, rape or murder, knife or gun crime, and always, of course, call your senior. Yeah, as it says, you're right, everyone can't detain patients, so you need someone else to help you to do that. Okay, a patient on an acute medical assessment ward has a new diagnosis of HIV. He's struggling to come to terms with the diagnosis. He's very anxious that no one should be told, including his family and other doctors. What do you do? So there's a number of options here. Amend the patient list so it's not clear. For example, you write things like retroviral illness. You leave out the word HIV. That sounds a bit grey. B, explain. That's a good word. Explain that you work as part of a team, so the other doctors need to. That's obviously the best answer. You explain to him, try and get him on side. So B wins. Okay, so you need to work out what the worst answer is. So C, eliminate all HIV with his notes is a terrible option because it's patient safety. He will not know the diagnosis, for example. D is a non-statement. Okay, treat him as you would any other patient under your care. Who cares about what does that mean? Yeah, all patients should be treated equally. So that's a middle statement. And then the other ones are kind of a bit crazy. So the best answer there is B, explain. And I think C is going to be the worst. Let's see what you guys have put. Yeah, so eliminating, everyone seems to agree, is the bad option. Explaining, being quite nice, is the best option. And then the middle ones are all a bit middle. The second best option was treat him as you would any other patient. That's a middle option because the other answers are negative, okay? To take all blood samples yourself is pointless because actually the phlebotomist is part of the team and they're within the confidence group, okay? And so amend the patient, oh, that's a bad thing, okay? So then the neutral answer is leave him alone. And then the other ones are all worse, except explaining. So B, D, A, E, C is the options. Okay, so in terms of telling, it's not about STI. So the whole point about, so it's about a balance, right? So with STDs or STIs as you call them, breaking confidence is a really bad idea because in order to, we've worked this out, in order to control STDs or STIs, you need to have the patients on board and they will not come for care with syphilis or gonorrhea or any other STD if they trust that you will not break confidence. So we never break confidence unless there is a definite risk to other people, okay? And that only really applied in the past to HIV. And you don't tell the family about the HIV. So if I have HIV, right? The people who need to know, and I'm unconscious, is my sexual partner. She needs to know because she's at risk and can have treatment. But my children don't need to know. And anybody else in the family don't need to know. So you only tell people who will definitely benefit, okay? Why is A better than E? Okay. They're quite great. A and E, let's have a look, right? So there's orange and gray versus gray and orange. They're quite close together, A versus E. Amend the patient list so that is less clear. And you'll think, why is A, what's the question? Why is A worse than E? Why is A better than E? Okay. It's simply that taking blood samples yourself is completely pointless, isn't it? So it's a worse option because it doesn't help anybody. Whereas the patient might think that, the list might help them. I mean, it's a weird question, I agree. It is not practical to do who wants his job, but that is what you should do, okay? Okay, let's move on. Okay, I'm afraid you have to accept the answer and move on. There's no point discussing it because the answers, if you have a point of view, that'll be your point of view. And this is the majority with the language point of view, and we should go with that because that is the right answer. You haven't got time, you see. I know you're thinking about, thank you for all these comments, right? But to be honest, it's not even worth thinking about. You just need to put the answer and move on, okay? Because the annoying thing is you'll find the next question, not now, but there'll be another question which is pretty similar, but just a tiny change in the wording changes the right answer, which is really annoying. And I've got an example of those that one of the students emailed me about. Okay, so there's a good question. Do you tell your partner? No, you tell the patient to please inform their partner. But I'll tell you, not in this paper, but I have had, also in real life, an unconscious man who came into casualty unconscious with the complications of HIV, and he had complete sarcoma and a sort of brain tumor, and was unable to talk and was on a ventilator, and he clearly had HIV. And what do? Do you tell anybody? No, he hasn't told you that he can. He's unconscious. If the daughter or son come in and say, "What's wrong with my dad?" you can't tell them. But if the wife comes in and you know that she's a sexual contact, then she needs to know, because she needs treatment and it's treatable. So that's the sort of thing that we're talking about, okay? Knowing you can't tell random people just because they're family members, okay? But you do need to tell a sexual partner because you will save their life. Because HIV without treatment is terrible, and with treatment now it's not terrible, but they need to know. So if they're not willing to inform, you tell the patient, you must inform your wife, and if you don't, I will tell her, okay? And then that's what you do in the exam. Okay, you're the FY on a GI ward looking for Mr. P. This is a good question. I like this. A 65-year-old man with alcoholic pancreatitis. Okay, so he's alcoholic. During your shift, the nurse bleeps and says, Mr. P's son's on the phone and wants to speak to a doctor. When you answer the phone, he says, how is Mr. P? My dad. How long to hospital? What do you do? Confidence, okay? You've got to keep confidentiality. So, what do you apologize and say, I can't reveal anything over the phone? That's what you should do. B, tell Mr. P's son that his son's doing okay, but do not reveal any other information. That's probably what you would do, but it's not what you should do. But actually, I would probably say, he's okay, but I can't really tell you anything more without his permission. Tell the son everything. That's terrible. That's obviously completely wrong. Maybe they're estranged. Yeah, maybe he wants to find out about what, maybe he didn't even know he's an alcoholic problem. He just knows his dad's in hospital. So you can't, so C is definitely wrong. Now D looks good, doesn't it? Confirm the identity of the person on the phone, explain to Mr. P that his son's on the phone and ask permission to disclose. Obviously D is the best answer, right? So that's easy. So D goes top. Tell us that everything goes bottom, and then the other three we can argue about, okay? So let's argue about it for a minute. Objectively refuse to give any information. That is what you should do. But the word objectively makes it a very negative thing to do. See, and this is the problem with the exam. It's about the language used that changes the answer. So you shouldn't give any information to the phone. So A and E are the same thing. A is don't say anything, and E is don't say anything. But A says do it nicely, and E says be horrible about it. And so what you have done, let's see what you put. Okay, so we all agree that we should confirm the identity and get permission, great. We all know that we mustn't break confidence for no good reason, so that's easy. So we've already got 8 marks. And then the middle three will give us some more marks. Now we don't agree really, let's have a look. So objectively refuse, that's a sort of 3rd and 4th, because it can't be 5th, so it's pretty bad, yeah? Tell the son something okay, that's what most people would do, but you shouldn't, okay? So that's also got a 4. And being nice comes second. Okay, so the answer here is D, A, and the middle ones we can argue about, is it B or E? Not clear, is it? Because they're both don't tell him, but one is being a bit rude about it, okay? And so it looks like, because there's the blue here, that B comes ahead of E. And so here we go, these are the answers. D, A, E, B, C is what you should do. So D, confirm, A, apologize, E, be horrible, objectively, B, tell someone is doing okay, and C is what you should do, but in real life, okay, you'd swap to them around, wouldn't you? So D, A, B would come ahead in real life, because in real life, you'd say, actually, he's okay, but I need to talk to him, okay? That's what you would do, really. So the right answer to the exam is the first one, unfortunately, and that is D, A, E, B, C. Okay, there's a few chats here. Is the hands up or? Oh, don't think about it, okay? Is reason second bottom because of, no. It's simply the wording of the language, okay? There's no logic to the exam. Don't try to make it into better than it is. I read in a SJT book that's saying they're okay, but I can't anymore, is breaking confidence. Yeah, that's exactly right, Anna. It is breaking confidence, so you shouldn't do it, but you would. That's my point, okay? The answer to the exam is what you should do, so you're right. What you wrote during the exam is right, we'll go with that. It might be. Is it because saying they are okay? Okay, most people who are coming to hospital, they're getting better. It's nice to say they're okay, but I need to talk to them to get permission, is what you would do, really. Okay, but what you should do is say, I'm really sorry, I can't tell you anything, and hang up, or say, I'll just hold on a minute. But the minute you say hold on a minute, they know they're in hospital, right? They know they're on the right ward. So the right thing to do is to say, I'll just check. Hold on a minute. So you must confirm identity if they're relations. Okay, just by asking, you've got to trust them. I mean, they might be lying, okay? But then you go and check with the actual patient, is it okay to talk to so-and-so? I think it's all right to say they're doing okay, but really you should not give any information at all for the SJT, because in reality, he might be estranged, and it might be that he doesn't want his son to know that he's in the hospital. So you be polite and yet not break confidence, okay? It would be lying, but don't worry about that, okay? Don't worry about, you see, if you think too hard about these questions, you'll end up wasting time, okay? Because that's not what this exam is about. This exam is about rushing through the whole thing. I should say one other really important thing, and that is that wherever you get in school-wise, most people get their first choice anyway, okay? So it has little impact, really. Okay, so an FY1 or a general surgery award, a firm working with a consultant known for expecting a lot from his juniors. The consultant is constantly rude to other FY1 and today shouted at her during the ward round for not knowing the patient list well enough. And FY1 feels a losing confidence. So what do you do? Empathize, that sounds quite a nice thing to do. Empathize is good. Advise them to speak to the ATO supervisor, that's not a bad thing. Advise to keep a note of each incident, that's also not a bad thing, but keeping a note of each incident is really with the view to complaining and saying, look, this is the list of things that he's done to me, and I'm putting in a formal complaint, which is not wrong at all. So that's something you should do too. Confront the consultant yourself and raise your concern. So that's personal suicide. So D is definitely a very dangerous thing to do. So let's put D at the bottom. Advise everyone to speak to clinical about the matter. Okay, so we're speaking to clinical, they're pretty similar. So E and B are pretty similar. You start with E and then move on to B. Confront, we all agree, is bad. And in the middle three, empathy. In fact, most people put that as fourth. So in fact, the best answer is E, okay, followed by B, advise everyone to speak to the education supervisor. So clinical, then educational, then plan to complain, then empathize. I guess the reason everyone put that fourth, and these are the answers the UKFPO had, is that it doesn't achieve anything, okay? And then lastly, confrontation is truly dangerous. So the answers here are E, B, C, A, D. E, B, C, empathy. Well, that's a nice word. It clearly didn't cut any ice with anybody else. And then D. Okay, you're tired now. You've got your last of 7 nights. So this is where you work night after night after night and try to sleep in the day. And on the 7th night, you're really truly knackered, right? And you work all night from 7 p.m. through to 8 a.m. So a 13-hour shift. And at 8 a.m., you want to go home, okay? The problem is you hand your bleep over to somebody else, and that person doesn't arrive at 8 a.m. and you've done a whole week of this, so you're really tired, okay? So what do? Do you patiently wait for your colleague to arrive? Continue to work in the meantime? That sounds quite noble, but it might be dangerous. If you've worked for 7 nights and you're really tired, then you're going to kind of possibly make a mistake, okay? And so that's not a great plan. Handing over to a nurse is not allowed, okay? Because you have to hand over to somebody who's either the same as you or senior. So handing over to a nurse, they can't do the medical jobs. They have got their own jobs to do, nursing jobs. So B is definitely a bad thing to do, okay? Contact the college, see why they are late and when they're to arrive. If it will be some time, then hand over to an SHO. That's okay, right? So this sounds like you're going to communicate. Communicate's always a good thing. So C is a winner, okay? And then if they're going to come get someone senior to you and say, look, I've got to go, I'm really tired, I'm going to hand over my bleep to you. These are the jobs that need to be done. Please hand them over to my colleague when he or she arrives. So C wins, B is the worst option. Find the consultant, hand over to them. I wouldn't mind that, okay? Explain to me, the hand over. I'll accept the bleep with trepidation, but it's a safe thing to do. Right? It is safe. Inform the DSO you're too tired to work, if you need to go home, hand over and give them your belief. Now, this is the same as C, really, except that C is doing it in a polite way. So that's why C is better than E, okay? And we've all agreed that B is dangerous. So that makes it, if you just get 1 of 5 in the right place, okay? So B is dangerous, comes last. C is being nice, comes first. You've got 8, and the middle 3 don't really matter. In fact, there's quite a lot of good consistency here because a lot of people put inform you are too tired. So that is the same as C, but this is a bit less pleasant for you doing it. Followed by find the consultant. I'll be scared about that. Waiting patiently sounds not safe. Okay, not safe at all because you're really tired. You'll start to make mistakes. So that is C-E-D-A-B. C-E-D-A-B. Okay, let's keep going with these. Professional question 3. This is question 10 in the list. Mr. Rogers is an old man who's discharged from your ward after a long and complicated inpatient stay. When you arrive on the ward one morning, he's got a £90 check for you to say, thank you for all the care I've received. What should you do? Accept the gift and don't say it to anyone? So you're very grateful for the thought, but you can't accept the gift. Suggest he donates the money to charity of his choice. So that's not unreasonable, okay? You can't accept it, but you should really accept it. So B sounds good too. Accept the money and split the rest of your team? Not sure about that. Refuse the money outright. Now you should refuse the money, but in a nice way. So the wording of that makes it less likely to be right. Speak to the ward sister. So the ward sister might be able to, if you're going to accept the money, it could go to the other patients on the ward. So maybe a TV for the ward or something that other patients benefit from, but not you. Thank you for the money and put it to the doctor's mess fund or speak to your consultant. Okay, so what are the obviously wrong answers? A is obviously wrong, isn't it? Keep the money. That's obviously a terrible answer. B is nice and being polite and saying, look, I really can't accept it is the best answer. Now you need to choose 3 good answers. Let's see what you put. So most people put B, yeah. Many have put C, give it to charity. That's not unreasonable. And F is give it to the ward. Okay, in other words, the ward sister will use it to buy for the ward because all the others are bad. One of you has put they're going to keep the money. Okay, not a good choice. Okay, and same with the team because the doctors are the richest, although everyone thinks you're poor, the doctors are amongst the richest NHS employees, so that's not right. So this one, A and D are bad. Refusing the money is the right thing to do. It's just rude the way it's written down here, outright. Okay, and same for doctor's mess fund, and the consultant won't be able to help you much. So this is B, C, and F are the best 3, and I think we all agree with that. Yeah. You're grateful for the thought, but I can't accept it. Please give it to a charity of your choice, and I'll talk to the sister to see if the patients can benefit from it. There's a few chat things. Let's have a quick look in the chat about this. It is rude. I thought you can't tell patients. Of course you can't. These are not real situations, right? You can't tell what to do. You can make suggestions. If you say, please give charity your choice, they'll do that because they really trust doctors. Okay, they will. However wrong it might be, they really listen to doctors. Yeah, the ward sister is someone who looks after the whole ward. And what I mean by that is immediately for the patients, for the other, let's say all the patients complain, because this is real, right? Patients say, I'm so bored, I wish the telly on the ward. And so the £90 might buy something towards, I don't know, a Sky dish or something to keep the other patients happy. The patients want, not staff, not doctors, not nurses, but patients. Okay, I think we should. Oh yeah, okay. You can accept chocolates, guys. Okay, I've got a slide on this, I think. So what you can do, you can accept very small things. Okay, you must not encourage gifts in an exam question. Okay, it might say there's various wordings. It's all about the English language. Okay, this is, as I keep saying, it's a test of English. So you can ask advice from the nurse in charge or whoever's involved with dealing with gifts, but don't accept any money if you possibly can avoid it. And if you do get a gift, you may not declare it in real life. That's what you should do. You should declare it because that keeps you safe from anyone saying, you've been given money by so-and-so, and that's why you're giving him this special extra treatment, okay? I can't define a small gift, okay? It's something that isn't going to have a huge financial impact, but if they're paid to be nice and wants to thank you, and it's awkward to refuse, and it's really small. £90 is not small. Drug companies I have a problem with. I don't agree with what drug companies do, and that's my personal view, so I better not colour the exam results. What do you mean by declare? You declare that when you start working, you fill a form in saying, I declare that I have no conflict of interests, and I've received no gifts. If you receive a gift from X and Y, you declare them on that thing, and then it's written down and hidden somewhere. And then if anyone accuses you, you can, well, I declared it, just like politicians do. I've declared it, and it's in my list of register of declarations, and so I'm not hiding it. It's not something that I've been given illegally or secretly. Drug companies. So drug companies, they sponsor lots of things because doctors prescribe drugs, and if you can write a prescription, you can spend a lot of money. Okay. Now, the thing about drug companies is that they have reps, and reps tell you about drugs that you don't need, because good drugs sell themselves. For example, you will never find a rep for prednisolone or metformin because they are very cheap, well-used drugs, and they should be used more for some patients, and they're not. So we should have education on the use of prednisolone in certain conditions. No reps because it's too cheap. However, if you've got an expensive drug that's in patent, there'll be a rep to come and educate you. You don't need the education, but they really want to push it. And so they have gone on to have, we can't give doctors money because that's called bribery and corruption. So let's sponsor a big dinner, and at the dinner we'll educate them about, ideally, the disease, not the drug. And they get around this by having what they call educational grants that are not linked to the drug. So they say, we will sponsor a meeting on asthma. And if you have a talk about asthma, you'll be taught about all the new treatments, and the new treatments will include their drug almost certainly. They don't need to, because the rules are they're not allowed to define the what you talk about, but they do. Okay, but officially, you need to be very careful about accepting money from drug companies. So if they offer a meal and educational things, that is, the GMC say you're allowed to do that, but be very wary about prescribing the drug that they talk about, because that's obviously a conflict of interest. Pizzas are good, yeah, okay. I would advise you in the exam to declare any gift, okay? Because if you declare it, that means that you have no conflict, because if anyone checks, you can say, well, I declared it. It's not something that I'm doing. Because the worry, right, is that we will receive money and then act secretly in that person's favor. But if you declare it, then that means you're not doing it secretly, and people know that you might have some variance, okay? Okay, let's keep going. So patient safety. Now, patient safety, there are two types of things, one of which is where the patient's life is in danger now, and the other is where it's not in, there's no real danger to patients in the short run, but there is in the long run. So let's do the long run first, okay? So one of your fellow FY1s wears her watch and jewelry every day and does not roll back her sleeves, okay? Now, infection control say, oh, you must not have long sleeves. You might contaminate people and spread infection, which is a really bad question. Sorry, Fahim has asked the question, where do I declare this? Chocolates, you don't need to worry about because everyone eats them on the ward, okay? So that's all right. That's not for you, that's for the ward. You declare it on your declaration of interest that you will receive the minute you start working. You get an email with a link saying, have you got any declarations? Okay, so let's move on to this infection control one, right? So basically, we all know the rules. You need to have bare below the elbows, okay? She doesn't believe in it. So what do? Do you calibrate it up with her and check, do you know hospital policy? That's a nice thing to do. Yeah, make sure she knows. Maybe she doesn't know. Or evil, report to infection control. So that's the report part of this that sound quite negative, right? So B is a bit negative, A is reasonable, Then there's, let's see what C. C is discuss it with a clinical supervisor. Okay, so that's like, why not talk to directly? That's why A is better than C. Yeah, if someone did something wrong, you start by saying to them, do you know? And if you have to tell them, these are the rules, by the way. Okay, so A looks good. And discuss it with a supervisor, a bit mean. It's not wrong, but why not discuss it with the patient, with the doctor herself? Continue to observe the situation, report it if it continues. Okay, that's a neutral answer. And ask the child what she thinks of the situation. Well, I know what she'll think. She'll think it's not good. So what are the best option is bring it up and check that she knows. So A wins and report is bad. So that's A and B being one last. The middle ones are all a bit much. Let's see what we put down here, what you guys put. Okay, so you all agree, almost 100% say bring it up with and discuss it is a good thing. And most of you have put report as a bad thing. And look, the middle three, no one can agree on, right? Discuss with clinical, that comes fourth. Continue to observe, that comes second. And ask what has come third. I mean, those three, and you can see how the gradients are quite variable here. And so clearly we don't know the right answer. But the right answer that's come out of this, and is the right answer in fact, is A, then D, observe, because there's a nothing answer, okay? Then it's either C or E. Let's see what they put, okay? They put A, D, E, C, B. A, D, so they put E, ask the charge nurse what she thinks, slightly ahead of C, discuss with the clinical supervisor, because basically neither of them will make a difference, and then report is the worst answer. And then I got this question, okay, a couple of years ago, saying, I've been going through some, I did that question. I've been going through some material and I came across a question strikingly familiar to the question we discussed at your session last Monday. I was wondering if you would be able to say like why the correct answer is so different, okay? And of course, the answer is the English language used. And this student has very helpfully, I thought D was bad because you don't know anything. Yeah, it is bad, okay? But there's worse than doing nothing, okay? Which is doing really, so let's go back. I'll just go back one, sorry guys. Sorry, there's that comment again. So the comment says, I thought D was bad because they're doing nothing. Yeah, that's true, okay? Yeah, D is bad. But the point is report is worse than doing nothing. That's why. So doing nothing is not always the worst option. That's something that people tell you is wrong, okay? Doing nothing is a neutral option sometimes, and doing something bad is worse than that. Okay, so anyway, get back to this, right? So I did that question, and then someone's looked up another question on the UKFPA website and says, oh, the answers are a bit different, okay? Let's have a look. So this is the question. This is and you'll see this paper. It's the one that's there, right? And it's pretty similar. It says at the morning briefing, you are informed by infection control that all hospital staff must, obviously, when they have any interact with patients during your shift, you know that your F1 colleague always has the sleeves down. It's the same question, right? And the options are tell the infection control that your colleague is not correct with the policy. Now that is the same as report. So that is the worst option. In fact, it's the same as my question. A is the worst option. Okay, we agree with that. And the best option is B. Speak directly with F1 colleague. It's the same, isn't it? It's communication. It was casual, whatever you do it. So I think our first and last option are the same. Okay. The middle ones are tricky. So raise up with the child nurse on the ward. That's in the middle. That's also the same. So the ones that are different are E. Discuss it with your special trainee. Okay, the registrar. That's come second, whereas in my question it was fourth. And then D, do not say anything immediately, but monitor the situation over the course of the next few days. That's come fourth. And the reason it's different is the wording of this question. So if you go back to my one, okay, the difference is that discuss the issue with clinical supervisor is done in a neutral manner. So there's a very slight difference in the wording, has changed the order, okay? And that is the problem, okay? And so there isn't a right answer. There is, how does this group of things sound to you and how would you deal with it? That's the problem with this exam. It's not like there is a right answer, you always do this. And the problem is if you try and learn right answers, that's why all this kind of learning answers is a waste of time. What's wrong with reporting? Okay, that's a really good question. it's not wrong, okay? It's not wrong. It's just not the right thing to do in this situation. What will it achieve? So what you need is communicate with the person and make sure that she knows, okay? If you report it to infection control, then they'll write down, she is a bad doctor. Then what happens? Nothing, okay? They're not going to sack her. So it's a complete waste of time reporting this sort of thing. And the important thing, right, is that there's no patient safety issue really. It's okay if they don't know slow their sleeves down. Actually, there might be a little bit of impact, but there's no direct danger today to these patients around you. So it's a bit pointless, okay? Whereas I'm going to say a question in a minute where it makes a big difference to immediate patient safety where you do something and report them. We can argue about who to discuss it with, right? Imagine you are, yes. Well, that's the problem, okay? I'm afraid we've just got to move away from science for a bit and just do the exam and then move on and hope. And the good news is that you all get your first choice, whatever you do. So that's all right, even if you get bad mark in inverted commas, okay? This chat's looking quite entertaining. Oh, I'll finish. You're getting bored, aren't you? Fair enough. I don't know. I'll keep going till I get worn out. Okay. I think another 10 minutes or so, maybe. Okay. So I'll put this down. Okay. As to why this, and you can read that later. I'll put this. This is going to be on YouTube, which your colleagues will get. Okay. So the best option is always discuss with doctor concerned. The worst option is go to infection control. That's the same as in the two questions. Okay. The middle of the same is both. And in our question, the clinical supervisor, similar to reporting to a higher authority, should be fourth. In the SJT question, that option is represented by discussing with your registrar. So it's the same sort of thing, okay? It's just how the wording changes it. Annoying, okay? I know it's annoying, but that's how it is. So the thing is, right, it's a situation that has no impact really on patient safety. So you can challenge it, okay, but actually it won't make a difference. And therefore, if it's not going to make a difference acutely, you talk to the colleague in private, and if there's no risk of patient harm now, you don't just rush in with anything further stages, and you can then act indirectly to try and, over time, change her behavior, okay? And you can then escalate, which is the last thing to do. Eventually, you can report her, but it's not something you do early. Now, so here is a different question. Here, there is a danger to patients. So you're working with another FY1 on a respiratory firm, and you've noticed on 2 occasions that your colleague's breath smelt of alcohol. This morning, he's slurring his speech on the consultant ward round. What do you do? So now this is patient safety because he's obviously inebriated and he might do something dangerous now, okay? So what are your choices? You need to do something now. You can't say, I'll discuss it with him later, right? So you've got to approach him directly if you can. So your options are advise to discuss with your executive supervisor. He doesn't know what the issue is. He's currently drunk. Interrupt the ward round and speak to the consultant in private. Interrupt the ward round, yes, because things are going badly wrong and he might do something really dangerous. So B is good. Make an appointment. There's no time to do that. Do nothing immediately. Monitor. No, you can't do. D is not a bad option if there is no patient safety urgently, but there is. Okay, so D is not a good choice. So B is the winner at the moment. Report to the GMC is a bit pointless. Ask him if he's been drinking. Yes. So communicate directly with him and say, look, and then ask the other F1 of the company don't change behavior. Okay, so H is also good. Go home, sober up because it's not safe, and then go and see your GP. So the best option is H and F and B, okay? Because all those things will save the patient trouble acutely now, which is a good thing. Yeah, all three are important. No, reporting the GMC is not always the worst option, okay? There are times when it's appropriate, okay? But it won't help in this situation because he's going to do something dangerous on the ward now. If you report the GMC, they'll respond in about 2 months with the wrong response. That's my own personal view, okay? It's not always wrong, okay? There are times when there are other situations when it's an important thing to do. And you have put B, F, and H. Quite a lot of people want to advise him to go with it. That's not terrible, but being safe, you see, this is disappointingly low. I think you need to interrupt the ward round if someone is drunk on the ward. So B is a very important thing to do because it's unsafe to not do that. and then approach him directly. And yeah, okay. So B, F, H are the answers. F and H, assuming this is conversation happening away from the patient. Well, you need to move him away from the, yes, and you need to try and do it quietly. But if he insists on misbehaving, you need to keep the patient safe by somehow removing him. So yes, assume you're going to move him, take him to a side room quickly, and then ask him those questions. Okay, I think, okay, so if there's behavior that does have an impact on patient safety, you need to do something now, in private if possible, and then you get other people to help you. And if that fails, then you escalate. Okay, we're near the end now, you'll be glad to know. Okay, so what's the most important thing you do? It's finishing the paper. Okay, if you leave out one question at the end, you'll get 0. They'll put you into the bottom of the decile immediately, okay? Because you'll lose 12 or 20 points. So you need to not finish. If you're going to guess, the ones, if you run out of time, the ones to guess are the ranking questions, because you will get quite good marks for those. Don't leave any blank, okay? The really key thing is don't think too hard, because you think and waste time and get 1 or 2 more marks by swapping 2 around, by waiting 2 minutes, you won't finish. The ranking questions are not discriminatory. The top and bottom options are obvious. Therefore, by guessing the middle 3, you're going to get 16 probably. So quick guessing is a good answer for the middle 3. And in fact, with the first look through, most people get 16 or 18. The middle options are real time wasters, okay? You can spend 2 minutes to get an extra 2 marks. It's really annoying, but don't, move on. Speed really matters. Some students complained, it's not fair, there's no time. And they wrote back saying, well, you've got to do time management, one of the GMC principles. So they say you've got to be able to time manage, and therefore that didn't work, okay? So make sure in this exam, time management is the single most important attribute that you have. So make sure you get through all the questions. If you get through rank questions with no knowledge, you'll get some quite good marks, even if you don't read the question. If you've done paper A and the flag question, the one with that flag of a country you've never heard of, people got amazingly high marks for that, okay? Despite never having seen the flag. So that proves that you can guess pretty accurately. Okay, you have the whole paper in one order, so just do it. Okay, make sure you've done all of the papers online. So having done these papers and seen papers A, B, and C, there are 2 printed papers on the UKPA website. Do them and read the feedback and be annoyed the fact that you don't agree with the right answer, but never mind. And then most importantly, before you go into your exam, actually do the whole paper of this awful rating, and then the ranking, and then the best of 3 of 8 rather. You must do them all, okay? That bottom line is the most important. Read it very carefully and finish the paper. Go with your instincts, okay? Put down the answer as you go. You are allowed, this is crazy, right? But you'll find you can label a question to come back to and then come back to it. Don't do that in this paper. You haven't got time, okay? Because you have to go to the very end before you can come back and choose a question you'll find, okay? Which is really annoying. Good luck. Exam in December. This is really important. I'm going to say this, right? Whatever happens, okay, even if you get a poor geographic place, the job you get is the same, okay? You're just training a bit more. And so it doesn't really matter if the job is what you worry about. If you worry about geography because of family, that's a different matter, okay? I think geography is important, but the posts are all excellent. They're all good wherever you go. The other thing is don't waste too much time with the SJT, right? Because it'll be over. And then you need to spend all your time becoming a good clinician and getting a good mark in finals in the future. That's much more important. So aim to do that, okay? The answer is yes, you can complete A and B. And from time, basically about once a week, I'll run it takes me a little while to run the program to send your feedback because it goes through all your answers. It's a bit of a manual job, but I'll do it, okay? So if you want to do it papers A, B, and C, do, okay? Yeah, let's see what else in the chat.